Minutes per organization, and we'll start with the BC Compassion Club Society.
Good morning, and thank you for having me here today. My name is Hilary Black, and I'm the founder of the first medical cannabis dispensary in the country, founded in 1997. In the interest of disclosure, I am also employed by a licensed producer, but I'm here today representing the BC Compassion Club Society, and thank you for having me. Cannabis legalization will affect some of the most vulnerable members of Canadian society, critically and chronically ill patients. We are offering you 7 recommendations in your submission to assist you in prioritizing patient needs. My comments today are focused on 3 main areas: transitioning the BC Compassion Club Society into the legal market, facilitating affordability, and supporting research. The submission additionally addresses the need for a legal range of products and advertising education restrictions. My colleague Marcel Vanderbeek will be making some comments about the need to eliminate barriers for small-scale growers. We have been distributing medicinal cannabis openly and safely for over 20 years. We are a nonprofit society with over 11,000 registered patients. We have a subsidized wellness center. Last year alone, we provided 3,400 holistic treatments like massage, counseling, clinical herbalism, and nutritional counseling for little or no cost to our membership. We are a frontlines harm reduction organization. Our clients are often marginalized, have numerous diagnoses, mental health issues, and substance issues. They are falling through the cracks of the healthcare system until we catch them. We have developed the gold standard of education. We know how to maximize benefits and minimize risks and avoid adverse effects. We offer each member a 60 to 90-minute intake session, an intake and education session. This is not possible in a pharmacy. Our community supports us, our neighbors, businesses, local police, healthcare practitioners, and patient organizations. We are a community. We have Christmas parties, picnics, and neighborhood cleanups. The courts have repeatedly commended our work. In 2002, the Senate Committee on Illegal Drugs toured our facility and recommended our model should be replicated across the country. I was nominated by Senator Pierre-Claude Nolan, may he rest in peace, and received a Diamond Jubilee recognizing our significant contribution to Canada. Our model is enshrined into Vancouver city bylaws with incentives to encourage the replication of our services because our practitioners have up to a 3-year wait list. Members of the task force visited us last September. You are all also invited to come and visit us. And when they released their report, Anne McClellan said, "What we learned there, putting aside certain issues of illegality, is that there can be a holistic, wellness-based, street-level approach that serves generally a highly marginalized population, and that this is a model that the report references and suggests the government should take a look at going forward." Despite this extensive recognition from many levels of government, as cannabis is legalized, we are at risk of becoming more criminalized than we were for the past 20 years. We have a massive responsibility to ensure the health care of our members is not interrupted, and we respectfully suggest that you share that responsibility with us. We are a historical medical cannabis institution. We implore you to do everything in your power to protect the roots of this industry. Washington and Colorado prioritize transitioning long-standing medical cannabis dispensaries into the new framework, and we should be following suit. For decades, I have watched patients struggle, choosing between purchasing the medicine that allows them to function and other necessities, like having groceries in their fridge. The problem is the status of cannabis. It's not an approved medicine. Access has been granted through the courts. It is in a category of 1 and not treated like other medications, although many patients access it through physician authorization. This status is problematic for both tax and insurance. Both of these could be solved by creating a fast-tracked regulatory pathway for cannabis to be an approved drug or medicine. For good reason, we do not tax other prescription medications. The courts have stated legislation imposing tax on medical cannabis resulted in confusion and uncertainty and needs work in Hedges versus Canada. Another solution is amending the Excise Tax Act to ensure medical cannabis is zero-rated like other medical necessities and prescription medicines to relieve this unjust financial burden. I'd like to introduce to you Ms. Munia Lababi, who has worked at the House of Commons as a parliamentary assistant to MP Peter Julian for over 12 years. She has been prescribed cannabis for her medical conditions diagnosed while employed by the House of Commons, including Crohn's disease, osteoarthritis, and cervical degenerative disc disease. She exhausted standard medical treatments for these devastating conditions, which proved to be ineffective and have harmful side effects. Cannabis immediately eliminated the need for immunosuppressants, steroids, non-steroidal anti-inflammatories, and other pain medications. It relieves her symptoms, which include nausea, insomnia, debilitating, unrelenting neuropathic and chronic pain. Without cannabis, she can't eat, she can't sleep, she can't function. The costs of her medication are unaffordable, but she cannot go without it. Her family has racked up thousands of dollars in debt in order to afford her prescribed medical cannabis. Even though medical cannabis lacks a drug identification number, Sun Life, responsible for the administration of claims under the Public Service Healthcare Plan, informed Munia that they are set up and ready to cover the costs of this necessary therapy once it is included in her plan. Now I'd like to introduce you to Mandy McKnight. She's employed by the Canada Revenue Agency. Her son Liam is 9 years old and diagnosed with Dravet syndrome, a catastrophic form of epilepsy for which there is currently no cure and the prognosis is unknown. Before trying cannabis, Liam had tried over 10 anti-epileptic medications that failed to control his seizures. He was still suffering up to 80 seizures a day. The side effects from the benzodiazepines and barbiturates were severe, including brain atrophy. Since being prescribed cannabis when he was just 5 years old, Liam is doing remarkably well, and his seizures are more controlled than on any other medication. The cost to the family is over $1,000 a month, plus HST. The alternative therapies, which are less effective and come with terrible side effects, cost between $2,500 and $3,000 a month, but they are covered. Both Mandy and Munia have had health claims for coverage rejected by their employer. Give medical cannabis a drug identification number or something akin to it, perhaps a cannabis identification number, to facilitate fair taxation and insurance. Take care of patients and Canada's public servants. It's the right thing to do. You could lead this government, the country, and the world by including cannabis in the Federal Public Health Services Care Plan. Treat patients with the dignity, compassion, and support that they deserve. We have an opportunity to be world leaders, expanding the evidence base of benefits and the safety profile of medical cannabis. We are facing an opiate and overdose crisis, and cannabis has tremendous potential as a harm reduction tool. We urge you to invest significant resources in human clinical research in cannabis and cannabinoids, prioritizing researching the potential of cannabis in managing pain and as a harm reduction tool for addiction and substance abuse. The Compassion Club has required tremendous experience with people struggling with problematic substance use and using cannabis as a harm reduction tool. We have witnessed the potential of high-potency edibles and resins being substituted for recreational and medical opiates, methadone, alcohol, and cocaine. This country needs solutions to the opiate epidemic, and cannabis has incredible potential. We implore this committee to do everything in its power to transition the community-based, long-standing, frontline harm reduction organization, the Compassion Club, and other long-standing medical cannabis dispensaries that pioneered the medical cannabis movement and industry into the new regulatory framework. Please consider the 7 recommendations in this submission to improve the care of patients. Thank you, and I'd like to introduce you to my colleague Marcel Van de Beek, who will be making some brief comments.
Good morning. My name is Marcel Van de Beek. My roles during the 19 years at the BC Compassion Club Society have included frontline dispensing of medicinal cannabis for 5 years, administrative for 15 years, and purchasing for 17 years. I've been working with the suppliers of the BC Compassion Club to ensure consistent supply of high-quality medicinal cannabis to our membership. As my colleague Hilary said, we are a registered not-for-profit society focused on providing holistic health care for those who most need it. We work with small-scale growers who cultivate specifically for our members at below-market pricing. They have cultivated specialty strains and have amassed a tremendous amount of expertise, including organic cultivation methods. None are related to organized crime, and all have taken on great personal risk to help us meet the needs of our members. We ensure the ideological values of the suppliers we work with, and we reject the producers who are solely profit-motivated. We have a strict cap on pricing, which weeds out those who are not aligned with our mission, vision, and values, including asking them for smalls and donations. For example, we have a cultivator named Joe who lived with a serious disability, grew organic cannabis for us. He used to donate thousands of dollars worth of cannabis every Christmas to help us gift it to our members in order to help alleviate their financial hardship during the holiday season. He used the small profits to fund a summer camp for disabled children. Sadly, he was raided by the RCMP. He was never charged, but as a result, he was forced to end his summer camp. These are the good, honest, hard-working, law-abiding Canadians this government is looking at as the criminals who must have the industry taken out of their hands. In fact, they're the people you should be bringing out of the shadows and into the light. The current process for applying to be a licensed producer is inaccessible financially to small-scale producers. and to small business people, which is part of what is needed to fill the supply shortages and illicit production. The pioneers of the medical cannabis movement and industry will not be included in the legal market unless you dissolve the onerous barriers to becoming licensed. Thank you for the opportunity to speak to your committee today, and we look forward to your questions.
And thank you for your comments.